My name is Barry Clark from Chipley, Florida. I initially fell 10 or 12 years ago on my shoulder and right arm. I originally injured it, but at the time I didn't have insurance to seek medical help or attention. Then at work, where I work now, is we were pushing out rail cars about 5:30 in the morning. The cars weigh close to 1 million pounds, so the tracks get dew on them during the night. Someone had set a brake. They didn't tell me they had set another handbrake, and I'd gotten out between the cars trying to find the problem why I'd stopped, and I was sanding the track, and I just turned around on the rail bed, and when I did, the gravel just slipped out from under my feet, and I initially fell just completely sideways like a tree falling on my, first thing it hit was my elbow, then my shoulder. And at that point I knew something was seriously wrong. I could lift my arm up next to my chest or keep it close to me. I could raise it up, up close this way, but I couldn't raise it over my head or over my shoulder. And then my wife, she told me through some patients of hers, she's a dialysis nurse, she had told me that about the Houston Clinic, how it was highly recommended. So I set up an appointment with Dr. Flandry, and in my initial consultation with him, examination, he told me pretty much what he thought was wrong, but he wanted to get an MRI to confirm it. The only thing he knew of was just a torn tendon at that time. If my bicep muscle was frayed, he would have to sever it, that I wouldn't have a lot of problem from that, but he just wanted to let me know. And then when Dr. Flandry, I went into surgery, he said that I threw him for a curve. Even the MRI didn't show up that I had a torn rotator cuff from 9 to 3. And he repaired the tendon back to my arm. He put in some anchors, reattached the tendon. He didn't have to cut the bicep, which I'm glad of that at my age. And then he found the rotator cuff was torn, and he repaired that. Then within 2 weeks after the surgery, I went to my first therapy appointment. I went back to the Dothan Center, Houston Clinic in Dothan. I had 3 different therapists over the course of my recovery, and all of them were knowledgeable, very helpful. It seemed like it progressed every week. My wife, she couldn't believe how fast I was recovering from it. It's been 4 months since my surgery. I feel like pretty much total recovery. I still have a slight pain if I put my arm in several positions, but I have total mobility. In fact, I think I have greater mobility than I did before the surgery. And they also tell me that my recovery was excellent. And I'm looking forward to seeing Dr. Flandry in November of 2016, because that should mean all my restrictions and limitations and everything's grown back the way it should.